So Nathan Adelson Hospice is one of the largest, or the only, nonprofit hospice in Southern Nevada. We've been around for about 50 years in Vegas and in the Pahrump Valley. We service many of the community members, and typically we'll go into the homes and facilities if they are residing there. When hospice is offered in the home setting, we offer a full range of support. We have a physician like myself that'll come and visit you in the home. We have registered nurses, RNs, who will come into the home, as well as nurse assistants, CNAs. We have chaplain services, social work services, as well as complementary therapists like aromatherapy, Reiki, other things like that, massage therapy as well. Try to make a very comprehensive, network for the patient to receive care in the home. So when we look at hospice care, a lot of times people get a little apprehensive. They frequently associate hospice with dying. And in some cases, yes, that is true. But just like how when we enter into this world, we have a range of specialists to help care for us. When we enter this world, as we age, we have a variety of different specialists. We are specialists at the end of life. And so when we say end of life, we mean that whatever medical condition that you are suffering from, there's usually a point in time where standard care that you are receiving no longer works as it is intended, or there are no treatment options left. Usually at this time, this is where we step in. This is where we change our focus and the paradigm of care, rather than seeking curative treatments, which at that point may not be on the table anymore, or they may be causing bad side effects. We say, instead, while we cannot make you better, we can make you feel better. And we support you in what we call comfort care for as long as you have. I've always been of the mentality where people are most comfortable in the home setting. A lot of times when you see patients in the clinic, it's a very sterile environment. You don't really see the patients and their families in the context of their own life. It may be more convenient for the physician, but for the patient, there's a lot that's missing. So when I go to the homes and take care of people in their familiar settings, I get a very accurate picture of what's going on. I figure out what really is bothering them. Is it just the physical conditions that are bothering them? Is it just the cancer? Or is it something more socioeconomic? Is there some spiritual support that is needed that has been unaddressed? And by seeing this in their own setting, I'm able to find the resources to help them out. Perhaps their pain is controlled, but they are wondering, what is it going to be like when they pass, or as they're passing, or what comes after? And so it usually may take a visit from myself and the chaplain to listen more to them, to see what is bothering them. And it kind of allows us to really take care of them in a very holistic manner. Rather than just the physical, we're treating both the spiritual and the emotional aspects of the dying process. I am trained in multiple specialties. My core training is in internal medicine. I'm actually a graduate of the graduate medical education program here at Mountain View Hospital. I was one of the first residents that graduated from there. I did my specialty training at UNR in Reno in hospice and palliative medicine and geriatric medicine. The majority of my training up there was at the VA in Reno, and I also served as a interim director for hospice at Renown Hospital, covering for Dr. Kelly Brogan. I'm board certified in internal medicine and in hospice and palliative care. And the one thing that distinguishes our company from many others is that our physicians are board certified in this specialty. One of the things that I tell people when looking for a hospice agency, looking for a palliative agency, is ask about the training. See what quality you're going to get, because standards do matter. I believe that the care that we render for our patients is top quality. And I know that this is what I've trained for and this is what I practice. We have, our organization has what's called a Lane Win Palliative Care, and so that is also a home program. So palliative care differs from hospice care in the sense where palliative care can be applied to anybody at any stage of their life. It is a supportive specialty of medicine which provides symptom relief to patients at any stage of their life. So the example I typically give is if a patient has been diagnosed with cancer, and it's not limited to cancer, but for the sake of the example, you have someone that has cancer, they decide to go through therapy. The therapy is very intensive, can cause a lot of side effects. Typically, when we think of cancer patients, we think hair loss, nausea, vomiting, pain from the cancer itself. Sometimes these symptoms get worse, and when they do, they can also affect the way they're being treated. Some patients may want to stop the therapy because it's so agonizing. But the problem with that is once treatment is modified or stopped, the benefits may also suffer as well. So in order to keep patients as successful in their treatment as possible, we encourage palliative care to be added because we manage the symptoms while you undergo the maximal effort from those therapies. And so by doing so, we try to help patients be as successful as possible for as long as possible. And there'll come a time where perhaps those treatments don't work as well, or the cancer spreads. And then usually our team on palliative care starts having those conversations with the patient and their family about considering hospice care. And then usually a transition's made where our hospice team comes in and helps out the patient as well. Our hospice has 2 inpatient hospice units, one that's attached to Mountain View in the medical office building, and another that is over near UNLV on University Drive. So these units serve as intensive areas where we can manage the symptoms of patients when those symptoms cannot be managed in the home setting. It may not necessarily be a place to live, but it is an area where instead of going through the hospital setting and all the waiting process of the ER, going through a typical hospital stay, if they're on hospice with our service, then they go directly to the unit if we cannot manage their symptoms at home. And so it allows us to have 24-hour nursing services there, all the other benefits of hospice, but contained under one roof. There's usually a physician or nurse practitioner that is rounding every morning. And there's a call system at night, so the patients and their families are supported 24/7. Not just for our patients, but for the community at large, we offer bereavement support to families that have experienced loss, but may not have the resources or may have not gotten to hospice in time. But we still help those community members out. For our own patients, that's also available. And a lot of the support doesn't end when the patient passes away. This extends for the next year or so, or as need determines it. So typically, if you are 65 and above, it's covered under the Medicare hospice benefit. And insurance, most insurances will cover hospice care, and that also includes inpatient stay as well, if needed. And so, more often than not, the hospice care in and of itself will be covered under insurance or Medicare. So we are available. I'd say people go on to our website, nah.org, and call the number that you see there, or use the contact form. A lot of times we have events around town. There's usually different ways to contact us, but that is probably the most direct.